I don't like Joe. I've found him on the battlefield. I've caught him with my dagger, and I've managed to get in a good blow from behind. How are you going to deal with that? Let's say I've come to you off the battlefield with an arrow stuck in me. Can you treat this?
Well, it depends where the arrow is embedded.
Kevin, I've come across this, which is the wound man, who seems to represent all the kind of medieval battle injuries a surgeon might be expected to face. And it kind of drives home how brutal a medieval battle must have been, that these are the kinds of wounds you might be expecting. Just how scary, how brutal would it be to be on a medieval battlefield?
Right, we've got to get away from this notion of battles, what we see in computer games or in reenactments, that a medieval battle wasn't tap and you're down and you're going to get back up. The point of a battle is to kill people. That's the whole point of it. To maim, to kill. You're not going to be walking away from a battlefield with a heavy silence. There's going to be men screaming. They're going to be screaming for their mothers. They're going to be in agony. There's going to be a stench over the whole place. Not just the iron smell of blood, but also the smell of feces and urine, because when men die, their bladders open. It's going to be hell. And I'm going to give you an example of this now. Now that's your size of a medieval arrow. It's not something thin and flimsy. This is coming off a 100+ pound bow. That is going to do some damage to you. This is not going to be, oh, I'm hit in the shoulder, I can carry on. It's going to knock me on the back and I'm in agony. And a good example of this is what was found a couple of years ago in Exeter. They found the skull, and it had just above the right eye an arrow wound. So that's the entry wound. That's the exit wound.
Wow.
That's archaeological evidence there. So we know how powerful these arrows could be. When we think about medieval battles, it wasn't a game. These people are out to maim and kill.
This all sounds very scary and daunting. Is there any way to survive some of these injuries that our wound man is suffering from?
Yes, there is. It depends on where the injury is. It depends on the surgical help you're going to get. And also, believe it or not, how rich you are. It's just not about having a lot of money and being able to afford the best medical care. When you're rich, you've lived in the best conditions all your life. So that means your immune system is pretty robust. You can have a little bit of an advantage in that you can fight off some infections. Somebody who's poor, their immune system is not going to be as tough.
So even before you get to the question of who can afford to pay for what, the elite are already starting from a better position.
This takes us on to the surgeon. If you're rich, if you're a lord or a prince, when you go off to battle, you're going to have a retinue of surgeons. Henry V, when he went to his Agincourt campaign, he took with him Morstead, the surgeon, who had organised a team of surgeons to look after his nobles. Your common foot soldier, however, who's not part of the retinue, he's going to have to go to the baggage train. There you'll have the surgeons who have just qualified. They're trying to build up a name for themselves. I mean, it may well have been that for some basic wounds, some soldiers would have known some basic first aid. Even though there's no actual proof, that's always a possibility.
Yeah, I guess you wouldn't want to go into a situation where you might end up like that without knowing at least roughly what to do if any of those things happened.
However, the thing we have to move away from is this idea that these surgeons are running out onto a battlefield treating the wounded. That did not happen. Battlefields are dangerous. They're not getting involved in that. There's no barber surgeons. In the medieval period, you're either a barber or a surgeon. Barber surgeons didn't come along until Henry VIII put together the Guild of Barbers and the Guild of Surgeons in the 16th century, in the 1540s. If you're rich, then you're going to have a master surgeon. So you're going to have the very best. Oh, even though if the surgeon thought that you weren't going to survive, he could refuse to treat you. It was up to a surgeon to say, well, I'm sorry, I can't treat you. It's beyond my skill. That was okay.
Is there also an idea of a reputational risk of failing to save a lord or something like that? It doesn't look good on your CV and could get you into trouble.
Oh, yes. Surgeons are self-employed businessmen. They do too many jobs and people die, they're going to get a reputation. This is why often a surgeon would back off if he knew he couldn't treat the patient.
Which I guess isn't the news you want to hear if you're asking for that treatment. So assuming I can get a surgeon to treat me because hopefully I'm not going to die, let's say I've come to you off the battlefield with an arrow stuck in me, can you treat this?
Well, it depends where the arrow is embedded. Now, a pretty easy wound would be this one. You've been struck in the arm. Everyone has heard about John Bradmore and how he removed the arrowhead from Prince Howell's skull in 1403 after the Battle of Shrewsbury. But where did that actually come from?
Yeah, so Bradmore's not creating what he did in a vacuum. He's not just suddenly invented this.
No, Bradmore was basically influenced by the previous surgeons. This is probably the most basic wound you're going to get. You've been embedded in the arm.
You say basic, I still don't want this. This still looks pretty horrible.
The first thing we're not going to do, we're not going to pull the arrow out by the shaft. If you pull an arrow out by the shaft will come away, and if the head isn't attached, it will leave the head inside the wound, and the wound would close.
Some arrowheads are quite barbed as well, so there's a danger of causing more injury.
That's why you always probe first. So you get a little metal tool in there, and then you'll have a feel to find out what kind of arrowhead it is. But there's another advantage of leaving the shaft in. You know exactly where the arrowhead is. So the rule is, if the arrowhead is more than halfway through, you push it through. If it's not halfway through, you can withdraw it. So the first thing we do, we have to push it through slightly, and then we just got to feel for the point under the skin. We've established where it is, so we push it through. Then we get our knife and we make a cut, and then we push the arrow through. And then we can snap the head off and we can remove the shaft.
You're adding to my injury to make it better.
But it's the quickest way to get an arrow out, causing the least amount of damage. Because if the arrowhead had been left inside, we'd have had to reopen the wound, widen the wound, go probing in. Then we will treat the wound. We'll apply some rosat, which is wine and honey. Now to them, anything that entered the body would imbalance the four humours and cause a hot abscess. Today we know that to be gangrene. Honey is an excellent antiseptic, even though they didn't realise that. So if you're going to put honey and wine into a wound, it's going to do some good. Or you might end up having a surgeon who likes been doing a bit of cauterising and then getting a cauterising iron, getting it hot on the fire and sticking it in there and then sewing the wound up.
So that's just going to stop the bleeding in the wound.
The trouble is it will trap the infection inside. Another problem that you had, infection. There's no antibiotics, they don't understand germs. Even a wound like that, even though from a surgical point of view it's pretty simple, there could be ramifications.
And I mean, thinking about our wound man as well, he's coming off the battlefield with lots of what look like crush injuries, so from clubs and things like that, maybe broken bones, fractures. Is that the kind of thing a surgeon can treat too?
A simple fracture, as long as it's not compound, you can put a splint on it. If it's a compound fracture, that's another matter. So you've got bits of bone sticking out. Because he's been hit with probably a mace, the bone has been totally smashed, been crushed. Then that gets to the amputation. The problem is the medieval surgeons really didn't like doing amputations. Forget the stereotype of a medieval surgeon cutting off arms and legs. They're self-employed businessmen. If you do an amputation and someone dies, that's going to go against you. The surgeons of the day always used to say, avoid amputation at all costs. Battlefield amputations didn't take off until the English Civil War under Richard Wiseman. And the reason was you had bullets, gun balls, and they were smashing bones. So amputation became a real necessity back then.
So amputation really was a last resort, but it did have to happen sometimes?
Yes, it did. We have found evidence of people who'd had limbs amputated. If there was no choice and amputations had to be done, they would always be done below the elbow or below the knee.
What are we using?
Roll your sleeve up, Matt.
My poor arm.
So the first thing we're going to do is put on tourniquet. So that's going to be twisted on, not too tight because I don't want to cut off blood supply. Just hold that there.
So that's stopping too much blood getting past there.
Now, what's going to happen is this. I've been paid in advance, just in case you die. We have a priest present.
Just in case I die. This isn't going well.
Exactly. Well, it is a dangerous operation.
You're not filling me with confidence.
I'm going to use the instruments devised by the Islamic surgeon Albacassus or Al-Zawi. We start with the catlep knife. Does that look very clean to you?
No. Oh, that's better.
Okay. We then will cut all the way around. We're separating the skin of the flesh from the bone. Once we have exposed the bone, we get the bone saw and we cut through.
Can I just ask before you start though, Kit, do I get any painkillers for this? Any pain relief?
I'm glad you asked that.
So am I.
Guess what? Depends on how much you've got.
Okay.
Theodoric of Lucca in the 13th century did mention the soporific sponge that had been soaked in dwale. Dwale was a mixture of opium, henbane, mandrake and wild lettuce held together with alcohol. It's not going to knock you out, but it's going to stop your mind in the pain.
Is that something like the sponge, that magic sponge they use in football? No?
Yeah, but a bit more effective. Ironic because one of the most famous Islamic physicians, Ibn or Avicenna, actually killed himself when experimenting with opium.
What a way to go.
Back to the amputation. We've got the bone saw and we go through as quickly as we can.
And do we know how quick that is? Can you do that really quickly?
Yeah, we know that the surgeons in the 19th century could get through there really quickly, perhaps in under a minute. We don't know for the medieval surgeons. There was no real way of measuring time. So we get through as quickly as we can. We then cauterise any bleeding, apply medicaments, sew together what we can, and then we put you to bed so you can rest and hopefully survive, if God wills it.
I've paid for you to cut the flesh off my arm, saw through the bone on my arm, burn my arm with a hot iron, and then sew it all together, and for your hope that I'll survive.
Yeah, but it's for your own good.
Wonderful. Sounds fantastic. But I'm looking at a fairly spectacular array of horrific, frightening looking tools on your table here. I'm looking at a mallet and chisel, really. Yeah. What are you doing with that?
Right. One thing that got mangled in battles were fingers. Not everybody is wearing a nice set of armoured gauntlets. If your finger is mashed, quickest way to take it off.
I was wearing gauntlets, I promise.
Put it in the joint, bang, off it goes.
I feel like health and safety would have something to say about that now.
They weren't around. Were they?
That's horrifying, though. It's horrific.
Yeah. But it's the quickest way to do it.
Okay, what else can you frighten me with off this table? What does this giant pair of tongs do?
Right. Some arrows had barbs, as we've seen. Now, the problem with a barbed arrow is pulling it out, because the barbs will catch on the flesh. This is a tool invented by Guy de Chauliac, the French surgeon. It's a wonderful little invention because that goes into the wound, encases the arrowhead, and allows you to remove the arrowhead without the barbs catching on the flesh.
So it's like clamshells, stop it tearing your flesh on the way out.
Yeah.
That's actually quite clever. I feel like that would be better than pushing the arrow through and chopping my fingers off with a hammer and a chisel.
Again, it depends at the depth the arrow is. We're doing this for your benefit.
Oh, thank you. And I guess the one thing that catches my eye on the table as well, that I feel like isn't going to make me feel better in any kind of way, is this terrifying looking spiky thing.
This is a trepanning drill, or a trepanning, used for drilling holes in the skull.
So it's not an actual drill.
Now, the brace and bit drill didn't come into the 16th century when Ambroise Paré, the French barber surgeon, invented it. This is the medieval version.
So what is the purpose of trepanning? Because I think we do have this idea it's for a headache and it's to relieve pressure.
We know why they are trepanning in the medieval period. Fractured skulls, embedded weapons. If a piece of skull penetrates the brain, to their mind, it could lead to a hot abscess, wherein the humours become unbalanced and become dangerous. Today, we know it can lead to meningitis or encephalitis. So it's important to try and ensure that the brain was not damaged, even back then. And part of that included either cutting a piece out or just cutting off one bit of the bone and then leaving the bone out. And you're going to help me do it.
Not to myself, hopefully.
No.
So how are we going to trepan this skull then?
How you are going to trepan it.
Okay.
So we're going to put you in the position of apprentice. First thing we have done, we have cut across and we've peeled the skin back. That is the most painful part of the operation. There is no nerve endings in the skull. We then insert the trepan. We just gently tap it in.
Presumably there is an art form to how far that needs to go in
Yeah?
to do its job, but to be safe.
Yes? Because we don't want to be penetrating the brain. So what I want you to do, I want you to put the drill between both hands and spin. Go on, do faster.
And all the time I'm doing this to a human being's head.
Yes, you are.
While they're still conscious?
Yes.
Sorry.
You have to work quickly and gently. But there we go. Started to make the hole. So I'll take over now. Okay. Ah, we're through. There we are.
Wow. So we've got a full hole in somebody's head. I could be looking at somebody's brain right now.
Not quite, because you've got to do a series of holes. So you might have to do a little circle or even a square, and then we lift out the piece of bone.
What would medieval people have made of seeing someone's brain?
We don't actually know. There's no record of that, but we do know that they were very particular about not penetrating it.
So they were aware how delicate that was and how important it was to be really, really careful.
And don't forget, this is a very, very, very expensive operation. Not everyone is having it done, only the rich.
Right, that trepanning demonstration it's really practical and visceral, and it made me want to try something else. So we've managed to get this ballistic dummy in here. We'll call him Joe for the day, shall we? And we're going to do some terrible things to Joe now. I wonder if you could show us what extracting an arrow from someone's torso might actually look like.
I can certainly try. So, what we're going to do a wound through the ribs.
So this will be going into someone's lung, potentially?
Into someone's lung, right? So we're going to insert the arrow through the ribs, and it's going to become lodged in there. Oh dear.
Joe's got trouble breathing right now, I guess, if that's
Yes. Now, the important thing we do not do is we don't jerk the arrow out. What will happen is the arrowhead could come off and it's going to fall into the lung. We don't want that to happen. So the first thing we'll do, we will get our knife and we will just extend the wound.
Just making a bit of space for you to work.
Exactly. If we need to, I can insert my dilators and expand the wound like so. But this is the real important bit about removing an arrow from the lung. We have left the shaft in. That gives us a guide where the arrowhead is. So we feed the hook into the wound, hold the patient steady. We can then hook, put the end of the hook around the end of the arrowhead. That allows us to keep the arrowhead on, and out it comes.
It's incredible that they had come up with ways to do these things. There's some very clever tools that clearly do the job very well.
Just shows how skilled the surgeons were with arrow guns. They'd had centuries of training.
Right, so you've managed to get an arrow out of Joe's lung and he seems to have survived that. But let's say, for example, I don't like Joe. I've found him on the battlefield. I've caught him with my dagger and I've managed to get in a good blow from behind.
Yeah.
How are you going to deal with that?
This is potentially a fatal wound. Wounds to this area are never good. This area contains your organs for processing food and producing feces and urine. So any wound here has the potential to turn nasty, cause peritonitis. We've gone into the side. At the depth, you perforated the stomach. The Vikings, if any wound penetrated the stomach, they would give the victim an onion soup. They would then smell the wound. If they could smell the onion soup, they would put the person out of the misery because there was nothing they could do. You've got peritonitis. And you're going to die a very slow, painful and nasty death. So what I'm going to look for is what's coming out of there. The one thing we don't want to do is pull it out. So I'm looking as to what's coming out. If it's gone deep enough, wrong angle, we could have feces coming out. You could have perforated the bowel. You could have perforated the bladder and have urine coming out. Both are fatal. Oh dear. I can smell something nasty. This means you've perforated the stomach. All I can do for this person will remove the dagger, put on dressings. There's nothing I can do.
Sorry, Joe.
even today, wounds in this area, they're still really, really hazardous because of the amount of bacteria producing organs in there. However, it's not all bad news. If you remove the dagger, and if you'd have just slashed, so
if I got him
and did a slash, providing you haven't perforated any internal organs, that's quite easy to treat. In fact, the slash might be so deep, his intestines might have come tumbling out. That's okay, as long as they haven't been perforated, because then, as long as they haven't touched the floor, we just scoop the intestines up, place them in, and sew the wound up.
It's like the 5-second rule, as long as it hasn't been out for too long.
The important thing is, as long as the internal organs have not been damaged.
So something that could look a lot worse from the outside, your gut being split open and your intestines falling out, might be more survivable than a dagger just stuck in your side.
Yeah. There's no antibiotics. Got peritonitis. That's the problem. Peritonitis is a killer. And you're going to die a very long, slow and nasty death.
It's been incredible to think about the kinds of wounds that someone might go to a medieval surgeon with after a battle and the ingenuity of the tools that were available. They look horrible, they look horrific, but clearly they're all perfectly designed to do the job that they're meant to do. I mean, the idea that you get this in and you cup it round an arrowhead so that you can pull it out without doing any damage is terrifying that someone's had to thought of that, but it's ingenious. And I guess the lesson I've taken away from this and from seeing poor Joe has been the best thing you can do is avoid a medieval battlefield.
That's very wise. Theodoric of Lucca said of medieval surgeons, every day a surgeon is creating a new technique or a new tool. And he was about the 13th century, 13th, 14th century. So even then, surgeons were on the cutting edge. They were developing new tools, new techniques.
So we ought to view this as the foundation of modern medicine.
Yeah, certainly modern surgery, yes. The techniques they developed, arrow wound treatment, became bullet wound treatment. What they found from stab wounds is still used today. Trepanning is still used today. So we do actually owe them a debt.
I'm just grateful, I guess, that I'm around in the days of antibiotics and anaesthetics.
Oh yes. Oh yes.